Good afternoon, everyone. Today, I'd like to share my presentation about the obesity and physical therapy. My name is Hanan. I'm a physical therapist at Rehabilitation Services Division at Johns Hopkins Aramco. In this presentation, I'd like to provide an overview of obesity prevalence from 2029 to 2022, definition of the obesity, health risk, obesity causes, physical therapy role in obesity management, effective and promising strategies of obesity prevention and treatment, and then the references. The prevalence of overweight and obesity is high among population of Saudi Arabia, and according to the 2019 Kingdom of Saudi Arabia World Health Survey, the prevalence of overweight is around 38%, and the median age of Saudi population is around 31 years. Obesity of young are increased risk for obesity attributed diseases that are more likely to occur in the mid and late life. As we could see here, the obesity prevalence in the last 10 years, it's clearly shown, steady increase in the number and the prevalence of obesity since 2092 to 2022. Obesity is a serious problem in Kingdom of Saudi Arabia, and it's found to directly cost a total 3.8 billion, equal to 4.3% of total health in Saudi Arabia. Obesity-related costs Saudi Arabia economy are both direct, like the cost of treatment, nursing care, and rehabilitation, and indirect, employee employee absenteeism in 2019, and a total of 15 billion, which equal to 9% of global burden of diseases in 2019. What is the definition of the obesity? Obesity usually defined by using the body mass index, and usually the body mass index around more than 30% more than 30 is considered obese, and more than 35 is considered extremely obese. And the body mass index is depending on the body weight as well as the height of the person. Obesity health risks, including psychological diseases, obstructive sleep apnea, cancers, osteoarthritis, type 2 diabetes mellitus, and gallbladder diseases. And what is the cause of diseases? There's multiple causes of diseases, including individual and behavioral factors, social factors, lifestyle behavioral factors, psychosocial factors, psychoeconomic factors, and biological factors, economical factors, and health factors. So, what is the role and what is the relation between physical therapy and obesity? Usually, the physical therapy role is come to treat the obesity attributed diseases or the condition related to the obesity diseases. And the most common diseases here is low back pain and neck pain, osteoarthritis, and plantar fasciitis. Low back pain was associated with a higher body mass index, and it shows that the high intensity low back pain or disability were associated with increased level of obesity. Obese women and women had approximately 20% increased risk of chronic pain in neck and shoulder. 89% of the patient had complete relief of their pain caused by osteoarthritis in at least one joint after reducing their weight. Plantar fasciitis is also a more common middle-aged, more common with middle-aged obese women, and it's could be resolved with reducing weights. In physical therapy clinic, the most common issue we usually treat it as the osteoarthritis, and it's the most common joint disease, especially the knee, that leads to knee pain and alter the joint functions. It generates a high proportion of health costs in many countries and has become a major public health issue. The health costs are directly related to the knee OA, such as knee replacement or medications consumptions. And it's found that 89% of patients had complete relief of their pain caused by OA in at least one joint after reducing their weights. As I said previously, the physical therapy usually treated the obesity-attributed diseases through analyzing the patient condition in detail, collecting detailed history, client's need, and their physical limitations due to the obesity, providing a full assessment to manage the client's secondary condition, gait abnormalities, posture abnormalities, functional activities, and endurance disabilities. Following that, physical therapists usually help the patient and client in setting the goals and or providing educations as per their needs. A treatment could include only education or gait retraining, posture retraining, endurance retraining, balance retraining, and treat the physical limitations that lead to inactive life or increase the risk of obesity again. Secondly, physical therapists play a role following the surgical interventions that manage the obesity, including assessing functional status post-surgical interventions such as bariatric surgery and providing continuous feedback to the clients and their family to set a plan of care. These are some effective and promising strategies of obesity prevention and treatment, including encouragement. So you have to encourage daily mobility and exercises, change our routine and establish daily routines. We usually recommend 30 minutes of walking per day. Do not overstress yourself and don't over care of the things or the stressors. We encourage socialization and interaction and communications with parents, colleagues, and others that might lower the stress level. Also, we encourage to perform self-monitoring behaviors like watching your meals preparation or using some pedometers that could help you to monitor your life. As for environmental or social support through parents, support group, or social media, or by medications, consult your doctor about the medication management. For diet, we would recommend to consult your dietitian for effective diet management. By conclusions, how can somebody manage their obesity? It's a collective effort by managing the stressors, doing regular exercises, maintain a healthy lifestyle, seek medical help when it's needed, and manage your weight and ask for behavior support when it's needed. Thank you.